I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And stay tuned to the end of this video, and I will share with you information on how to acquire the skill of medical coding. Now let's get right into our next video. Let's talk about updates to the Supplemental Medical Review Contractors, or SMRC projects. For more information on the SMRC and their work, click on the link below. The SMRC's current project involves cardiac rehabilitation. Cardiac rehabilitation is a comprehensive physician-supervised program intended to restore patients with cardiac conditions to active and productive lives. The program furnishes physician-prescribed exercise, cardiac risk factor modification, psychosocial assessment, and outcomes assessment. Cardiac risk factor modification can include education, counseling, and behavioral intervention. Medicare Part B covers medically necessary cardiac rehab for patients who have had certain cardiac procedures, such as coronary artery bypass graft surgery, an acute myocardial infarction within the past 12 months, a diagnosis of stable angina pectoris, heart valve repair or replacement, percutaneous transluminal coronary angioplasty, or coronary stenting, or a heart or heart-lung transplant. The SMRC is conducting medical reviews based on the analysis of national claims data from 2016, which will help determine compliance with coverage requirements. For information about Medicare coverage requirements for cardiac rehab services, refer to the Medicare National Coverage Determinations Manual, Chapter 1, Part 1, Section 20.10. I'll place a link below. Because of these findings, in March 2017, CMS requested that the SMRC perform medical reviews on over 7,500 cardiac rehab claims from January 1st, 2016 to December 31st, 2016 to determine why they were properly paid under, or if they were properly paid under Medicare Part B. The SMRC's review will require examination of medical records related to the claims and claim data. To obtain these records, the SMRC will be requesting additional documentation from select providers. To avoid the denial of a claim during review, it is very important that providers respond timely to the SMRC's request for additional documentation. Providers should include in their responses all documentation that supports the medical necessity of the billed services. Check out the SMRC's website for findings and additional education on this cardiac rehabilitation project. There are 5 key steps to becoming a certified marketable medical coder, and I would like to share them with you. Click the link to receive our free checklist and free email course on the 5 key steps. So click the link in the box below. I promise you won't regret that you did. And as always, be safe, be kind, and don't wish for it, work for it. Take care, and I'll see you in the next video.